Hello, I'm Dr. Smith, and today we're talking about something many seniors enjoy every single day: coffee, and how it can actually be used in a smart way to help prevent diabetes and keep blood sugar levels more stable. As we age, our bodies process sugar differently, and insulin sensitivity often decreases. This means that even normal eating habits can lead to higher blood sugar spikes. Now here's the interesting part. Coffee, when consumed correctly, contains natural compounds like antioxidants and polyphenols that may support better glucose metabolism. But the key word here is correctly. Drinking coffee the wrong way, especially with added sugars, artificial creamers, or at the wrong time, can do more harm than good. Many seniors unknowingly turn a potentially healthy drink into a blood sugar disaster by adding flavored syrups, excess milk, or drinking multiple cups late in the day. So the goal is not to stop drinking coffee, but to use it wisely. When consumed in moderation and prepared properly, coffee may help reduce inflammation, improve insulin sensitivity, and even lower the risk of developing type 2 diabetes over time. However, each person's body reacts differently, so it's important to observe how your body responds after drinking coffee. Start by simplifying your coffee. Keep it as natural as possible, and pay attention to how your energy and blood sugar feel afterward. This is the first step toward turning your daily coffee habit into a supportive health routine instead of a hidden risk. Now let's talk about timing, because when you drink, your coffee matters just as much as how you drink it. Seniors should ideally consume coffee in the morning, preferably after having a light, balanced breakfast, rather than on an empty stomach. Drinking coffee first thing on an empty stomach can trigger the release of stress hormones like cortisol, which may temporarily raise blood sugar levels. This effect can be more noticeable in older adults, whose hormonal balance is already more sensitive. Instead, try having your coffee about 30 to 60 minutes after eating something that contains protein or fiber, such as eggs, whole grains, or nuts. This helps slow down glucose absorption and reduces the chance of sudden spikes. Another important point is to avoid drinking coffee late in the afternoon or evening. Poor sleep quality is strongly linked to higher blood sugar levels and increased risk of diabetes. Caffeine can stay in your system for several hours, disrupting your sleep cycle even if you don't feel it immediately. Seniors should aim to have their last cup of coffee at least 6 to 8 hours before bedtime. By aligning your coffee habit with your body's natural rhythm, you can minimize negative effects and maximize the potential benefits. Remember, coffee is not just about taste. It's about timing, balance, and understanding how your body reacts throughout the day. Let's move on to what you add to your coffee, because this is where most people unknowingly increase their diabetes risk. A plain cup of black coffee has almost 0 calories and does not significantly raise blood sugar levels. However, once you start adding sugar, flavored syrups, sweetened creamers, or condensed milk, the situation changes completely. These additions can turn your coffee into a high-sugar drink that causes rapid spikes in blood glucose. For seniors, this is especially dangerous because the body takes longer to bring those sugar levels back down. If you find black coffee too strong or bitter, there are healthier ways to improve the taste. You can add a small amount of unsweetened almond milk or a splash of low-fat milk. Natural spices like cinnamon can also be a great addition. Not only does it enhance flavor, but it may also help improve insulin sensitivity. Avoid artificial sweeteners as well, as some studies suggest they may interfere with metabolism and increase cravings for sugary foods. The goal is to keep your coffee as close to its natural form as possible while still making it enjoyable. Think of your coffee as a health-supporting drink, not a dessert. Small changes in what you add can make a big difference over time, especially when it comes to maintaining stable blood sugar levels and reducing the risk of diabetes. Portion control is another crucial factor that seniors must pay attention to. While coffee can have health benefits, drinking too much of it can lead to negative effects such as increased heart rate, anxiety, digestive issues, and even fluctuations in blood sugar levels. For most seniors, 1 to 2 cups of coffee per day is considered a safe and beneficial range. Going beyond this amount may increase caffeine intake to a level that stresses the body rather than supporting it. It's also important to consider the strength of your coffee. Strong, highly concentrated coffee contains more caffeine, which can affect your body differently compared to a lighter brew. If you enjoy multiple cups, consider making them weaker instead of consuming strong coffee repeatedly. Hydration is equally important. Coffee is not a substitute for water. Dehydration can also impact blood sugar control, so make sure you're drinking enough water throughout the day alongside your coffee. Another helpful tip is to monitor how your body feels after drinking coffee. Do you feel jittery, tired, or unusually hungry? These can be signs that your coffee habit needs adjustment. Keeping a simple daily routine and observing your body's responses can help you find the perfect balance that works for you without negatively affecting your health. Finally, I want to emphasize that coffee alone is not a cure or a guaranteed protection against diabetes. It should be part of a broader, healthy lifestyle that includes balanced nutrition, regular physical activity, proper sleep, and routine medical checkups. Seniors who combine smart coffee habits with healthy eating, such as consuming whole foods, reducing refined sugars, and including fiber-rich meals, are much more likely to maintain stable blood sugar levels. Light physical activities like walking after meals can also significantly improve glucose control. If you already have diabetes or pre-diabetes, it's important to consult with your healthcare provider about how coffee fits into your daily routine. Everyone's body is different, and personalized guidance is always the safest approach. Think of coffee as a small but powerful tool that, when used correctly, can support your health journey. By choosing the right timing, avoiding harmful additives, controlling portions, and maintaining an overall healthy lifestyle, you can continue to enjoy your coffee while protecting your body from the risks of diabetes. Take control of your habits today, make mindful choices, and let your daily cup of coffee become a step toward better health rather than a hidden threat.